I'm Robin Mead. You're watching the Pediatric Network on Accent Health.
Did you know there are over 100 different types of arthritis? The most common being rheumatoid arthritis, but symptoms can include pain, stiffness in the bones or joints, and the key is to understand your specific condition so that you can better live with it. And Catherine Calloway has more on this.
If rheumatoid arthritis has taught Anna Wilson anything, it's that having a good attitude will take you far.
You're going to have the pain when you overdo it, and sometimes when you think you're doing nothing. It's lifelong. I think the best thing for us is our attitude and a good relationship with our doctors, because you can get depressed.
20 years ago, Wilson was diagnosed with RA, a chronic inflammatory disease of the joints that affects an estimated 1.3 million Americans.
It can start suddenly, or it can be more gradual in onset, and it can be associated with other systemic signs like fever and not feeling well overall.
The symptoms of rheumatoid arthritis are often difficult to distinguish from many other types of arthritis or pain affecting the joints. What patients will usually notice in the beginning is morning stiffness when they wake up or after they sit for long periods of time. Other things that they notice are swelling, especially in the small joints of the hands and the feet, tenderness, and a lot of pain.
While the cause of RA is unknown, research has shown there is a genetic link.
So in patients who have family members who have rheumatoid arthritis, they're at higher risk for it, and also that there's a link with smoking.
Rheumatologists Lipson and Law work as a team to ensure their patient gets the best treatment available.
Originally, patients were treated with NSAIDs like ibuprofen and naproxen or Aleve, along with corticosteroids or prednisone to control the symptoms. And what we learn is that they accumulate joint deformities or damage to their joints that impair their activities of daily living. So the newer paradigm is once the diagnosis is made, usually patients are treated with a combination of glucocorticoids that help to alleviate symptoms, but also what we call disease-modifying agents. And some of the newest agents that have come out over the last 15 years are what we call the biologic agents.
If left untreated, you can become quite disabled from rheumatoid arthritis. A lot of pain, a lot of disability, and time off of work. But now, since the advent of, even before the biologics, the disease-modifying agents, people are not having joint damage, they're not having erosions, and they're able to live full-time lives and go to work. So our goal is to be early and aggressive and treat as soon as you can.
While it's taken years to find the right combination of medicine to control Anna Wilson's pain, she is optimistic.
But I pretty much do everything I wanted to do. I'm still holding on. I'm a little slower. So I just have to plan my days, try to get a little more rest, and pace myself. Thank you.
For CNN, I'm Catherine Calloway.
Dr. Lipson could not stress enough the importance of living a healthy lifestyle. Now, by that, she means maintaining a healthy weight, incorporating diet and exercise, and when your pain is under control, talk to your doctor about starting a routine. For example, water therapies, a good choice for people with arthritis. A great resource for all of this is arthritis.org. The Arthritis Foundation has support groups all over the nation that can help you.
It's time now for an Accent Health Mind Bender to test your baby smarts. When can you start giving your baby low-fat or skim milk? Is it 12 months, 18 months, or 24 months?
18 months.
12 months.
24 months.
Do not restrict your children's consumption of dietary fat and calories in the first 2 years of life. Use full-fat dairy products until at least 24 months. Your baby needs calories from dietary fat for her brain to grow and mature normally. The early months and years of your child's life are critical for the normal development of her brain and body.
Life's greatest joy can become a real challenge when your little one isn't feeling well. You need help you can trust. Little Fever's Fever Pain Reliever Drops provide safe, gentle, and effective relief of fever and pain symptoms with acetaminophen. Little Fevers contains no artificial colors, flavors, saccharin, alcohol, or gluten, and offers infants and young children everything they need and nothing they don't. Little Remedies. We make it all better.
Folks, why won't we go to the doctor? My uncle called, speech all slurred, complaining his arms numb. He called everyone. He even called my daughter Tiara, because you know, she's got a year of nursing. Everyone thinks he needs to go to the doctor, including me. So he said, well, will you take me? I'm like, I'm on the road. He goes, I'll wait. Stroke's no joke. If you or someone you love have symptoms of stroke, don't wait. It may be too late. Dial 911. Time lost is brain loss.